COVID-19 has been impacting the world for almost 2 years now. From schools and businesses closing to mask mandates to a worldwide vaccine rollout, the southwest corner of Indiana has officially lost over 1,500 people due to COVID-19. So where do we stand now in the trajectory of this worldwide pandemic? Have we seen the worst of it? Data researchers and local health officials join us to discuss COVID-19. That's coming up next on WNIN Newsmakers. Welcome to Newsmakers. I'm Amy Mangold. We've gathered a few experts to discuss where we stand locally with COVID-19. Our first guest is one of Indiana's leading COVID-19 data researchers, Dr. Micah Pollock, an associate professor of economics and the director of the Center for Economic Education and Research at Indiana University Northwest. Dr. Pollock, thank you so much for taking the time to join us today.
Thank you for having me, Amy.
Well, I know you've been a very busy person. First off, let's just level set with what your role is in terms of being a data researcher and getting this information out. I know you're an economics professor, not bringing the healthcare perspective to it, but really helping us understand the numbers and trends behind it, right? Can you give us kind of a summary?
Absolutely. So, about 2 years ago, I started looking at COVID data when it first was published by the state. Looking at data both because I'm curious what's happening, but also I wanted to know, how it might affect me. And then as the state released more and more data, I just kept naturally looking at it and wanting to answer questions about trends and how cases were changing. And then I ran into more and more people that were also asking the same questions. And as a teacher, my job is to answer questions when people have them. And as an economist, I'm used to looking at a lot of data and then finding ways to present it in, ways that can be easily understood by, students or the public. And so it was kind of a natural fit, just bringing the data to the people in, the most effective way that I could.
Well, I know that we've talked that this has been almost 2 years now. We thought we already had one surge and maybe we're going to see the end of this. Now we're in this new Omicron surge. So tell us, have we seen the peak in data terms of the Omicron surge in southwestern Indiana, or do we see kind of the peak coming?
I think we have seen the peak probably about a week or two ago, actually. It's been really interesting with Omicron because it moves so quickly. We see real differences across the state by counties. So up here where I am in Northwest Indiana was one of the first places to get hit with Omicron. And so, we had cases skyrocket during the month of December. And since the beginning of the year, they've actually dropped back to below where they were. Southwest Indiana has been a little bit behind. Perhaps, it just took a little bit longer to get started. And we're seeing the same pattern there, only it started in maybe the middle to later December. And cases have skyrocketed. Probably around the 20th or so of January, cases have peaked, and since then they've started to fall off some. We're nowhere near back to the levels we were, before Omicron arrived, but we're well on the way, and I think they're falling rapidly.
Well, and we're talking with Dr. Heidi Dunaway, and I know one of the conversations is about hospitalizations being a lagging indicator. So now that we are kind of saying that we've seen the peak, are we going to start to see that relief in hospitalizations coming as well?
Yeah, so typically you have cases that happen first, which then lead to hospitalizations several weeks later, which then lead to a wave of death several weeks after that. And we're seeing those waves play out. And so if you think of the COVID-19 trends in terms of like a roller coaster where the front car is cases, that's over the peak and starting to decline. Hospitalizations are very close to the peak, probably a little over the peak. In fact, they've dropped a little bit. On January 25th, Health District 10, which is all of Southwest Indiana, had 258 people hospitalized for COVID. Now it's down a little bit to 253. It doesn't sound like a huge decline, but that is the first real decline we've had in a long time. So I think that middle car of hospitalizations is probably over the peak of the roller coaster, but you still have that last car, the average daily deaths, which we may see continue to rise before it peaks and starts to decline as well.
So do you see any major differences between this surge and the previous surges?
There have been a lot of differences. For one, it just has happened a lot faster. Previous surges, the original strain and even the Delta variant were stretched out longer. presumably because it was less transmissible. And then the other really huge difference we've seen is that Omicron is just infecting a lot more people because it evades immunity much better than previous strains. So people that are vaccinated, people that have been previously infected, are getting infected again. And thankfully, the hospitalization rate has been much lower. So it's been close to maybe a third the rate we had with Delta. And so even though we've had maybe, 5 to 10 times as many cases and infections as during the Omicron wave as we had during the last Delta wave or even during the winter wave of 2020, that hasn't led to more hospitalizations. It's still led to, in terms of numbers, very similar levels of hospitalizations as those previous waves that were resulting in a lot of hospitalizations. But thankfully, it's a much smaller fraction of the total cases, which is excellent. And deaths as well have been down.
Well, and I know the conversation around this one has been a little bit more centered around the children. Have you seen the rates of the children be much higher, even in our area? And is there any hypothesis or any guess as to whether maybe children are the ones that kind of fueling this, or what does the data show there?
I don't think there's evidence that they're necessarily fueling it, but you have to remember that kids, especially those under 5, which are not eligible to be vaccinated, but even those older 5 to 11, are the least vaccinated groups. And so it's going to spread the fastest in the least vaccinated groups. And that's what we're seeing. It's still spreading in the older groups, but as a proportion of cases, now we're predominantly seeing much, much younger, especially ages 5 and under, 5 to 11, that we didn't really see before Delta. I don't think that they're leading the spread or causing the spread necessarily, but as the unprotected age groups, they're the ones that are getting hit the hardest.
Well, and to your point, Pfizer has now approved requested approval, I should say, to get kids under 5 vaccinated. Do you think that's going to help with the pandemic and bringing about the end of the pandemic?
I think for those parents that want to get their kids vaccinated, it'll make a huge difference. I have a kid under the age of 5, and I would go and get them vaccinated tomorrow if I could, because I know how much of a reduction in risk that creates. I mean, their risk is already very low, but it can be, exponentially lower with the vaccine. My hope is that this current wave will kind of continue to fall off. And if we do have the next wave hit us, it'll be after the point where at least those of us that want to get our kids vaccinated are able to. That being said, vaccination rates among kids are the lowest, even those that are eligible of any age group. And so I think a lot of parents think about the risks and say, well, the risk of a serious side effect or illness for a kid is relatively low, so maybe I won't get them vaccinated. And so I think that we'll have that problem overcoming kind of that obstacle, because even though the risk is low, you get the same reduction in risk for kids under the age of 5 that you would, for someone that's older.
So let's go back to economics. As an economics professor and the effect of the pandemic on unemployment. Unemployment now getting at record lows in many areas. How do you see this playing out in terms of the pandemic, and if it becomes endemic, and getting people either back to work, or are we going to see the Great Resignation, the effects of that for a long time, because now people are just out of the workforce completely?
Yeah, that's a great question. I prefer the term great reassessment almost than resignation because, we did see a lot of resignations of people quitting their jobs, but it was because many of them saw the pandemic as an opportunity to reassess their position and what they were striving for in their career. And just to give you an example, if you have someone that is working full time, maybe, with kids, that person may be spending their full income on, childcare services. And with the pandemic and childcare services shutting down, many realized that, hey, why am I working full time to only then turn my whole income over to, someone to take care of my kids? I could stay at home, do a little bit of work on the side, and that makes me economically better off. And so we're seeing a lot of stuff like that. People reassessing their careers and saying, there's no upward growth potential in this job, so I'm not going to do it anymore, or I'm not going to go back and, get yelled at while I work in the fast food industry or the retail industry. And we've seen the labor force just decline because of that, because people are choosing to be out of the labor force because the conditions are better for them to be at home. And I don't think that's going to change unless employers realize that this is a factor for them and find ways to make jobs attractive again, like providing more paid time off, more sick days, more ability to work from home. All those sorts of things would have to change in order to attract workers to come back.
All righty. Well, and do you, I know this is kind of from a data perspective, have you heard of any variants coming our way? I mean, these viruses mutate. We didn't know Omicron was on its way, so any line of sight in terms of if we're looking at another variant that might cause another surge?
Well, I mean, there's been a lot of media coverage lately about one of the stealth variants of Omicron that's called, which is BA2, which is a subvariant of Omicron. It seems to be a little bit more infectious than the original variant of Omicron, but potentially not any more severe, which is good news. It's too soon to know how that'll play out. I'm not terribly worried about that variant, but with the amount of spread we have globally, it's really only a matter of time before some other variant comes along. And we're really just kind of hoping that the roll of the dice means that we get a variant that is maybe less severe, even if it is more infectious.
All right. Thank you so much, Dr. Pollack, for your time and all your information as you're trying to help keep us all informed. Have a great day.
Thank you for having me, Amy.
Well, joining us now is Dr. Heidi Dunaway of Ascension St. Vincent. We also invited Deaconess Health Systems, but unfortunately they were unable to provide a representative at this time. Thank you so much for being with us with such a busy time, Dr. Dunaway.
Well, thanks for asking me, Amy. I'm happy to do it.
Well, we know this past few weeks, I mean, the hospitals have seen COVID rates that are as much, if not more, than what we saw earlier in the pandemic. So tell me, after almost 2 years of being within this pandemic, how are the hospitals holding up? How is the staff holding up? Just kind of walk us through what's going on right now in your world.
I think everyone is just tired of the pandemic. There's no question about that. Across all of our community and region and throughout the world. In healthcare, I think it's been especially challenging. You know, we've really, seen things and experienced the pandemic in ways that I think it's hard for anyone outside of the hospitals to really imagine. So there's a lot of fatigue. And, there's an incredible dedication that healthcare workers have. And it's amazing to me how resilient people really can be in these situations. But it does get tiring after some time. And one of the challenges I think that is particularly, I think in our view, is the fact that, people working in the hospital, whether it's nurse, patient care tech, housekeeping, physicians, et cetera, they're dealing with the volumes that we're seeing daily, not all COVID, but just extremely busy. Everyone is stretched. But they also then leave the hospital and worry about safety of their families or have child care issues to contend with and the same things everyone else does. So I think they really are struggling a bit in terms of feeling like they truly get a break.
Oh, I can totally understand. I mean, hospital workers are people too. They, as you mentioned, they have families and kids in school and husbands and wives to tend to. So our hearts definitely go out to them. It seems like Omicron we're hoping might be easing up just a little bit. But what are you seeing in the hospitals now? Because hospitalization is really kind of a lagging indicator, isn't it, in terms of how things are trending?
Yes, so usually when we see the peak in the positive cases, the hospitalization rates usually peak a couple weeks later. So when we look at the positive cases coming through right now, Southwest Indiana may be just sort of rounding that curve. We may be just getting over the hump in terms of the numbers of new cases. So we anticipate we will continue to see some increase in numbers of COVID hospitalizations for at least the next few weeks. And that was actually the original prediction. They were saying mid to late February they thought hospitalizations would peak, and I think that's probably about where we are.
I think also some people are a little bit concerned that when you start to look at the numbers, we're starting to potentially see maybe an increase in vaccinated patients being hospitalized. And I think that sometimes individuals who are vaccinated are getting a little bit worried, like, well, if I got the vaccine, how do I end up in the hospital? How do we kind of talk about that? And then do you know the rates of the people who are in the hospital who have actually gotten boosters? Is that the next step in terms of preventing a vaccinated patient by being ultimately hospitalized?
So yes, we have seen more vaccinated individuals contract Omicron. Generally, if they've been boosted, it's generally mild illness. The people that we are seeing that have been boosted that may be hospitalized with Omicron are generally those who have high-risk situations to start with, reasons that their immune system maybe doesn't work as well, whether it be medications they're on, if they're diabetic, obese, if they've got certain cancers or in treatment for cancer. So, typically they are higher risk individuals if that's the situation. It's not a large number though, and there was actually a study released just this week showing that for individuals who are vaccinated and then boosted with Omicron, it was approximately a 23-fold decrease in the risk of hospitalization versus those who were not vaccinated or up to date. The CDC has changed the terminology now to be current with vaccine, meaning if you're more than 5 months out from the mRNA vaccine, you've received a booster, or more than 2 months out from Johnson & Johnson, you've received a booster. So I think we're looking at vaccination also a little differently in terms of how long it's lasting, how long there's protection.
Well, speaking of vaccines, I know people some were encouraged to get the vaccine right on. And then as it became that they were going to have subsequent vaccines, then I think people were like, oh, are we going to have to keep getting a shot from now on, and how often? Do you kind of have line of sight in terms of what we might be seeing in vaccinations? Will it be a yearly shot? Do we know yet how much immunity will last for us if you're vaccinated?
A lot of those questions we're still learning more about the virus. Coronavirus is a tricky one because it's an RNA virus, and so the type of virus this is, its genetic material has to go through an extra step for the virus to replicate, which means it's more prone to mutation. So we see a different flu vaccine each year because the flu virus also mutates. Coronavirus, I think, it will eventually become endemic, meaning that it's not as widespread. We're not seeing the degree of infection or death. But we do anticipate we will have to have boosters. The frequency of that, I think we still don't know.
Well, and I think in this age of instant gratification, our culture is looking for the answer now and the permanent answer. But how do we help people understand that this evolution is really, we have to be patient as we learn through this and as we have research and as we learn about this virus, that there might not be the answer at any given time as this evolves. Do you battle with that all the time?
It's difficult because, as you mentioned before, we were talking about the fatigue that people feel, the fatigue of wearing masks, the fatigue of restricted activities, et cetera. And I think everyone's yearning for just getting back to something, more normal. With this virus, this particular infection, we do know it mutates. We do know that we're seeing mutations in other parts of the world and watching closely as those develop and we learn more about them. I think it's just tough, I think, for everyone to really get their head around that there's not a quick fix. It's hard when you think about the fact that, we got our polio vaccines when we were young, and we had our measles and mumps and rubella, and typically you carry that immunity through most of your life, where it's much lower risk. But there are certain infections that just tend to mutate and change, and we have to continually teach the immune system how to fight them and keep those under control, and COVID is one of them.
Well, and very quickly, just to end, Dr. Dunaway, are you seeing more hospitalized children now in this wave?
We have seen we've seen a small increase with Omicron. We've definitely seen a lot more infection in the pediatric population. There's no question in terms of the number of cases, much greater, definitely gone through schools, sporting teams, et cetera. And kids are definitely passing it to those who are more vulnerable. Some areas of the country definitely did see more hospitalizations with Omicron. We've been fortunate it was not a huge jump, but it was a slight increase versus the previous strain.
Well, Dr. Dunaway with Ascension St. Vincent, thank you so much for joining us during this extremely busy time, and please wish all of our healthcare workers the best as we're supporting them through this really trying time for them.
Thank you for having me, Amy. I appreciate you getting the message out to everybody.
Now we're joined by Joe Grease of the Vanderburgh County Health Department to continue our discussion. Thank you so much for being with us today.
Absolutely, appreciate you asking.
So I know, first let's level set on the role of the health department in all of this pandemic. We've got researchers and medical professionals, so where does your department fit in all this?
So early on, we really were kind of a hub to bring groups together. We worked with the hospitals, we worked with local government, all kinds of businesses, other community agencies, really to make sure that everybody had information that they needed, also to share guidance that was coming from either the CDC or the state health department. So we're kind of a go-between here with our community, also trying to get out positive information about testing and vaccinations to make sure everybody had all the information they needed to protect themselves, protect their families. So it's been a kind of a wild ride for the last couple years, and we're trying to get back to normal and do some of our normal duties and things, but yeah, we're still here, we're still able to help folks, and we want to try to make sure we're doing everything we can to protect people.
Well, numbers are always a big topic, so how about our vaccination rates locally and in our county?
So right now, I looked at the state's website today. Vanderburgh County is at 58.8% of eligible people are fully vaccinated, so 5 and up. We have 58, almost 60% of our population here, which is a good number. It's kind of slowly started to climb over the last few months. It doesn't go up as quick as it was early on last year. So those numbers we hope do continue to climb, and we are seeing a lot of people though getting boosted as well. So the booster shots are about 60% of the overall shots that people are receiving here locally.
So right now, just to clarify, do you consider a person with the 2 vaccines fully vaccinated, or are they now moving to only consider those who have had the 2 vaccines and the booster as being fully vaccinated?
So depending on the time frame of when you receive those first two shots, if you're outside that 5-month window, they do recommend you get boosted to be considered fully vaccinated. So yeah, we would recommend people, if you're outside that window, to have that full protection, get that booster shot. Helps increase your immunity and can hopefully help keep you out of the hospital, keep you off ventilators, things of that nature.
Right. And how about the vaccination rates for children? If you don't have hard numbers right now, I know they change on a daily basis. Are you seeing that trend up? Are they kind of leveling off? What's the trend there?
The numbers for kids are the lowest of any of the population. So I think families and parents, they're leery sometimes, and they want to maybe try to make sure that they weigh the risk between the vaccine and maybe contracting the virus. So I know there's a lot of trepidation there sometimes, but we would recommend people talk to their family doctors, get as much information as you can, try to find ways to gather that information for you and your family and your kids to make sure you are protecting them as much as possible. But yeah, those rates for kids tend to stay a little bit lower than really the rest of the population.
Well, we talk a lot about increasing the rates of vaccination for that special herd immunity and things like that. With so much community education out there and so much access, do you think that we will actually be able to really boost that number and really make it peak, or do you think that this is just going to kind of be a slow burn, because if they haven't gotten it now, will they get it?
Right. If you look at the state of Indiana, there are counties that are hitting that close to 70, maybe even 75% rate. We're right around 60%. So there's a wide range throughout even the state of Indiana. I think there's a possibility to get more and more people vaccinated. We're working closely with the state. We try to talk to other counties and other areas to make sure that we have all of the information. Maybe somebody's come up with a better way to say it or to convince people. But right now, if you're not vaccinated, you may be hard to convince. But we're going to continue to recommend, and we hope that people protect themselves best they can. It's kind of up to them and their choices for their families. But yeah, we do recommend get boosted, because if you are vaccinated and boosted, you're going to be better protected. Your risk drops dramatically from going to the hospital, from being on a ventilator, and from dying. And especially those folks with some other underlying health conditions, those folks we really hope will consider getting the vaccination.
We talked with Dr. Dunaway. I think that that's also an issue in terms of people wondering why people are being hospitalized, even having been vaccinated and boosted. But what we're hearing is it's really the underlying health conditions.
It is, I think so. The coronavirus, COVID, has played a hard role with people who have some of those underlying health conditions, diabetes, some pulmonary issues. Obviously, being overweight can be an issue. So, we hope that those folks really gather the information that they need, talk to their doctors, make sure that they're protecting themselves, because it can help increase that immunity. And if your body can fight this off, then you're less likely to hopefully go into the hospital.
Thank you so much, Mr. Grace, for joining us. We appreciate all your information.
My pleasure.
Thanks to all of our guests for joining us. We'll see you next week on WNIN Newsmakers.